Welcome, everyone, to another episode of Three Plastic Surgeons at a Microphone. As always, I am Sam Jejurikar from Dallas, Texas, and I'm joined by my colleague Sam Rhee from Paramus, New Jersey. We have a pinch hitter today for Dr. Salvatore Pacella. We are lucky enough to be joined by Dr. Lawrence Tong, esteemed plastic surgeon from Toronto, Ontario. Welcome, gentlemen. Today we're going
Thank
to
you.
talk about a couple of some disparate topics. We're going to talk a little bit about dermal fillers, which are really, really popular, and then we're just going to talk about procedures in general that we find to be popular in our own practice, and how this kind of matches up with the American Society of Plastic Surgery guidelines. So before we get into the meat of things, I'm going to turn it over to Dr. Rhee for our usual disclaimer.
This show is not a substitute for professional medical advice, diagnosis, or treatment. It's for informational purposes only. Treatments and results may vary based upon circumstances, situation, and medical judgment after appropriate discussion. Always seek the advice of your surgeon or other qualified health provider with any questions you may have regarding medical care, and never disregard professional medical advice or delay seeking advice because of something in this show.
Okay.
All right. I am going to start by talking about dermal filler longevity. So most people know what dermal fillers are. These are materials that are injected usually into the face. They're typically made of hyaluronic acid, and they are used to restore or enhance facial features. The thing I wanted to discuss with you guys today is that traditionally we've been taught or we've been told that these fillers last a certain amount of time, typically anywhere from about 6 to 9 months, depending on what type of filler it is. And then by that time, the filler has gone away, and then the patient will come back and sort of re-up and, add some more filler. I'm just wondering if you two have experienced some of the things that I've seen, in that I think that these fillers actually last quite a bit longer in the face than what's been advertised. So for example, I have patients who started filler with me, and they would come back every, 6 months, 9 months to get a refill. But then I would see that over time, they would come back and I would say, okay, you don't really need anything, or you just need way less than what we've typically done for you. So if any of you have comments about that or experiences with that,
I definitely
Go ahead.
Okay, I've definitely seen what you're describing, and basically in the same patients too. It's not necessarily the patients that are first or second time filler patients, but patients who have sort of had a lifetime of filler. I have definitely noticed that as if you think a filler lasts for 12 months, when a year goes by, it looks as though we just did the filler, and these are patients that we've done, for years. I've also noticed when you're operating on some of these patients, like when you're doing a facelift on a patient who has had chronic filler in their cheeks or in their nasolabial folds, and they've had it for a decade or for a chronic period of time before the surgery, that even when you're operating on these patients, you can actually see some of the filler in their soft tissue when you're doing the surgery. So I think, yeah, for sure. I think there is definitely a substantial amount of filler that over time the body just stops reacting to, and it stops metabolizing.
I mean, I tried to do a quick lit search, and I have found a couple case reports where people have done MRIs on some of these patients, and it has definitely lasted for at least 27 months or plus in one case report. And then there was a case report about non-surgical rhinoplasty where they were using hyaluronic acid, like a Restylane or a Juvederm, to help the nasal contour, the dorsum, and it lasted up to 8 years in some of these patients. So I agree with both of you guys in that I've seen that in my own patients. I do think it's location specific or dependent in some ways. I think if there's a lot of motion, it tends to disappear faster. It seems like every lip injection I do, it looks awesome at like month 3 and disappears no matter what by month 6 to 9. But if I put that filler, say, in the cheek area or in an area where there's not a whole lot of motion or pressure, it seems to last a lot longer. And I don't know exactly why that is. I don't know if it's just that these areas are metabolically inactive, or there's just not a whole lot of blood flow or contact. I'm not sure. It's, you know, is it because of the volume as well? Like if you inject a small amount, does it resorb faster? Do you find if you inject a larger volume, it tends to stay longer? I mean, that's sort of my guess to a certain degree.
I think part of this stems from probably that we don't have a complete understanding of how fillers dissolve or break down. And, we have general ideas, but exactly what you said, Sam, location to location probably has a factor to do with it. And also, like you said, volume. So I think that what happens is that maybe once you get to some critical mass of volume, your body might not be able to break it down as effectively anymore. For locations, just like you had said with the non-surgical rhinoplasty, I do have a very large Asian population, and that is a pretty popular procedure to inject the bridge to get a higher dorsum. And I'll have patients that they'll come to me because they eventually want to get just a proper rhinoplasty, so surgery. So we want to melt these fillers before, and actually they're fairly difficult to melt sometimes. I don't know if
Yeah.
you have experience with difficulty in trying to get rid of these fillers sometimes when a patient feels that there's too much and they want to dissolve.
Just yeah, that's actually where I was going to go to next, because I think there's another variable that we haven't even touched on, which is not all hyaluronic acid fillers are the same. There's different degrees of cross-linking, and there's different molecular weights with some of these. And I've personally found that the fillers that we tend to use more in the cheek area and in the jawline area tend to stick around a very long time. And particularly, I'm not sure if you guys have tried to dissolve Velux or used a lot of Velux, but that's a really hard filler to dissolve. Um, I mean, I have used 500 units of it on a patient to dissolve it all the way around their jawline area, and have partially successful in that. When you're trying to dissolve filler in the nose, Larry, what kind of hyaluronic acid filler is it you're trying to dissolve?
Well, a lot of times these patients aren't originally my patients. They'll be going to
Okay.
med spas and things around the city or even out of the country. It's usually some sort form of hyaluronic acid, and I will inject these people sometimes 3 or 4 times, and it still doesn't look like it's completely gone. Maybe because I thought of it as maybe because there's potentially many layers that the filler could be sitting in. You're not injecting the hyaluronidase, so that's contacting all the filler. But there's not that much tissue in that area. Not like the cheek, which has potentially more thickness, or the jawline. So I'm not exactly sure why sometimes it's hard to dissolve some of this stuff.
Yeah, I've done pre-treatment dissolving with hyaluronidase or Hylenex, whatever you want to call it, to dissolve the hyaluronic acid. And I never like, especially if I'm like pre-facelift or something where I'm trying to get rid of all the filler in the cheek, I can never get it on one go. I always feel like I got to go in, I'll get maybe like 85% of it, and then I'll have to have the patient, even if I'm massaging the crap out of that area and trying to get that hyaluronidase into every compartment or every layer. And then I feel like there's still a little bit of residual. Um, I
And then
almost
when you
feel
do the facelift, it's in
there's
there
still
still.
some in there
Yeah.
sometimes. Exactly. And so I'm always like, I don't know whether I should just leave it and not even bother trying to dissolve it before I do any sort of facial procedure. Should I just, like, what do you guys do? Do you try to be aggressive in terms of getting rid of the filler before you do a surgery treatment, or do you just leave it in place and go with it?
For me, as you've heard for rhinoplasty, I'll try to dissolve it because I think that can affect, um, the height of the dorsum ultimately. For facial procedures, if it's in there, I don't try to dissolve it. I think that if it's there and it's not really going to go away, maybe that's something that can enhance your result to some degree. The downside or the flip side is, well, what if it dissolves later on? Have some uh, a result that's maybe not symmetric or deflated compared to what you would have had. So I think with time we'll sort of find out what the best practices are. But at this point, I don't do it for the face.
Yeah, I'm very much like Larry on this one. For noses, I think it's important to dissolve it. For for most facelift procedures that I'm doing, I'm adding volume, and doing some fat grafting at the same time as well. And I think the volumes of filler relative to the volumes of fat you might be putting in are not really comparable. There's a lot more fat that you're putting in relative to what the filler volume is, and so I tend not to spend a lot of time trying to dissolve it preoperatively.
What is your favorite filler? What are the brands or types that you really like to use in terms of your own treatments?
So for me, I usually stick with the Restylane and the Juvederm products. So I don't know if it's exactly the same in Canada as the US, but Restylane Lift is sort of my usual go-to for sort of all purpose. So I usually tell patients that I break down the filler into sort of three conceptual categories. Sort of a sort of a bread and butter filler, which would be like the Perlane or the Restylane Lift, which you can use in most places in the cheeks, in the nasolabial folds, marionette lines. Then there's the softer fillers, I will call them. So those would be like your Lobella, which is used for the upper lids, tear trough, and the lips. And then it's sort of how I think of as the thicker fillers, or the Volux, which Sam had mentioned, or Voluma, that are meant to give you sort of more volumizer.
Yeah, I mean, I use I mean, kind of all of the fillers that are out there to some degree in our practice, but the ones that most commonly are used in our practice are the Juvederm family, whether it's Volbella, Volux, Voluma, Volure. They're very confusing. Ultra Plus, like they're and you know there's different molecular weights, different levels of thickness. So for the tear troughs, we use Volbella a lot for that for for the nasolabial folds. I use Velour for the cheeks, Voluma for the jawline, Volux. And you know there's role for things like Sculptra or practice, and we use some of the RHA fillers a lot too. So, I mean, I can't say there's a favorite go-to. It just sort of depends on the patient.
Cool.
Um, One thing that I wanted to mention is that because you see this phenomenon where the filler stays around for a long time, I think that that may be in part why we're starting to see patients' faces have more distortion, because they're used to getting their, whatever, couple syringes every, half a year or a year. And then over time, they just keep doing that. And your healthcare practitioner or whoever that's doing the injection isn't sort of looking out for that or putting the brakes on things. That's when you can start looking sort of unnatural.
Yeah, I would say my patients probably think I'm the biggest neg when it comes to fillers out there. And if any of them are listening, they know like half the time they'll come in, like a year past, and I'll be like, yeah, it looks pretty good. I don't know if we really need to do the nasal labials that much right now. And they want it. Like they're like, it's my time. You said it was 12 months. It's time for me to get my filler. And I'm like, I don't think so. Let's just wait another 6 months and see what happens. And I am so glad when you said you wanted to bring up this topic, Larry, because I felt like it justifies my sort of aesthetic eye when I look at my patients. And also to say, yeah, sometimes you really don't need it. And it's kind of weird as a plastic surgeon to be like, no, don't give me money to do something. But sometimes we actually do need to say that in order to sort of preserve, like you said, a proper aesthetic proportion for a person.
Y- There's a difference, either one of you guys, in terms of the level of aggression that you, as board certified plastic surgeons, might use in putting in filler versus a nurse injector or a physician extender injector, people whose sole practice is injecting. Whereas for us, it's just a small portion of our practice. Do you think that we are more likely to put the brakes on it?
Yes. So you know, you've heard, I'm sure you've heard that saying, when if the only tool you have is a hammer, everything looks like a nail. So I think that, if that's the only thing you have to offer, not everyone, but you're more likely to just go ahead and, put some filler in. Hopefully, everybody will have the sense and judgment to be able to say when, more fillers is not a good idea. But I think, um, as board certified plastic surgeons, because we have other options, and maybe because, we see that the things in more sort of a global sense, we're more comfortable with telling patients when to stop, or when to hold off on things.
I agree 1,000%, Sam. I'm glad you brought that up because um, it's not necessary because we are surgeons. Uh, Honestly, fillers and all of these other non-surgicals are a relatively small part of my practice from an income perspective, right? Like all of us will make way more money doing a procedure than we would doing, filler treatments. And so for us, if you go to a med spa and all they're doing are fillers and that's their bread and butter and that's what they're constantly doing all day, they're I mean, let's face it, we all have financial incentive, but the financial incentive for them to do more is more. And I have seen patients who have gotten three times the amount of volume that I felt like would be optimal for their proportions or for their aesthetic features. And not to say that we're so much better. It's just honestly, sometimes our financial incentive is just a little bit less to sort of really look out for, what is right. Now, unfortunately, sometimes that also means some surgeons might push surgical procedures more than maybe non-surgical. But that's where, as board certified plastic surgeons, we are supposed to be relatively impartial, appropriate care providers and know, listen, we understand what your goal is, and this is what we think it would take to help achieve that goal. And that's really a responsibility that we have as providers, that nurse injectors, physician extenders, like it's really the same responsibility for all of us. It's just that the pressures are maybe slightly different for them as they are for us.
Yeah.
Yeah.
One interesting thing that I see sometimes is I'll have a patient come in and they'll say they have bags under their eyes and they want to get a blepharoplasty. Then I start talking to them and looking at them. And, I've seen more than a few cases where it's just filler causing these bags, and, suggest dissolving it. And that sort of takes care of the problem.
Yeah. I mean, the realities are many, many, many more syringes of filler in the US, and I imagine Canada as well, are put in by nurse injectors and physician extenders than by physicians. I think I heard it was 60 or 70% of all is done not by physicians,
Wow.
yeah. And so that's the reality of it. And the truth is, I don't mind that because I don't really want to practice full of doing fillers all day long. Even in my own practice, the majority of filler patients are either done at our med spa or by the physician's assistant in my practice. And so, who is very good and very conservative, by the way. But I mean, it's just, the realities are we all know a few surgeons who love doing fillers and seek it out, and it's a huge part of their practice. But the majority of us would much rather be operating, and we do this as a service to our patients. We're not really going out trying to push a lot of this.
So true.
Yes. And I think as surgeons, um, fillers are not entirely, this is different subject matter, but fillers aren't entirely benign. It's not just putting too much in. You can have some bad complications, which you probably discussed in a different podcast previously. And, that also informs my decision as, when you're putting this filler in, if you don't have to put it in, every time you're putting more filler in, you are increasing risks of other things.
Always. I'm very mindful of that. It's a small thing, but it's not nothing. Let's just put it that way for sure.
Mhm. Well,
Um,
did you want to talk about another topic, Sam, or are we out of time?
I like that. That was pretty good. I think we should end with that. As always, thank you, Dr. Jejurikar, Dr. Tong. If you're in Dallas, definitely go see Dr. Jejurikar. That's whom I would see. And if I was in Toronto, I would definitely go see Larry because having trained with these guys, it's nice to sort of pick their brains and sort of see how their practices have developed. And you know what's always blows my mind is every time we talk about this stuff, I listen to you guys and I'm like, yeah, that's what I was about to say. Like the whole hammer nail thing, like, you know, the same thing with the physician extenders and the nurse injector. Like you guys like read my mind. You guys, it's so funny how we are in different cities and we do different things, but so much of how we manage and think about these patients and how we manage patients is the same. So I really love that.
Do I
Anyway,
complete you?
uh, you, you always complete me, Larry.
Can you feel me and Larry inside your head right now, reading your thoughts?
I hear your voices even as I think.
Yeah.
Anyway, thanks so much, guys, and I'll talk to you guys later.
All right. See you
Yeah.
later, man.
All right.
See ya.